The POWER trial is absolutely a game changer. This is a very important breakthrough in our approach to our #1 public health problem, not just in this country but across the world. The obesity epidemic is going to overwhelm our problems with chronic diseases of aging. So to see a scalable, very inexpensive therapy that can be done at arm's length without too much intensivity from the provider side, and with fully engaging the patients in the role and the process of their weight loss, I think this is a very exciting development. And particularly to see the sustained weight loss to 2 years. That's not something that we typically see. We usually see weight loss through 6 months, perhaps 12 months while the intervention's going on, but then during the less intensive phase, out to 2 years, people rebound right back up to where they started, and sometimes even overshoot. Well, I'll be interested to see those data from this trial, but we know that a 5% weight loss typically would be associated, and in these patients that was about a 15-pound or so weight loss. But that would typically be associated with things like clearly lower blood pressure, significantly lower blood pressure that can be associated with lower outcomes like stroke and heart failure. Probably not a huge change in lipids, certainly not much in LDL. We might see a modest improvement in HDL, but clearly also improvements in blood glucose levels. So less incidence of diabetes and better control of diabetes in people who already have it. And increasingly, trials like this can be linked into, and as it moves to the mainstream, can be linked into the electronic health record. I think it's very important to keep the physician engaged in the process here to provide not just the initial advice, but ongoing support for their patients as they're struggling with weight loss. We know it's hard. We know that the physician and the physician-based office practice have a very important role in supporting the whole process, and that I think was shown in this trial. But the key here is that we can have contact with our patients ongoing, in the framework of a trial like this, that will help them continue to be successful and not only have exposure to them for 10 minutes once every 6 months.